I just want to give you an overview. You saw the title of my talk, and I will tell you that even though my focus is supposed to be on the role of nursing, what I really would like to speak to is the role of healthcare providers in general. And of that, I think there is a very large area of healthcare in rural communities, of course, that is provided by nursing staff. What I'd like to do is talk about some of those challenges, and I'd also like to cover a few promising approaches. So what has worked, what has not worked, and what could work. At the bottom, one of the things I wanted to mention is, and Arlette referred to this at least briefly in her talk, is about the work that's been done between Accenture and AMREF. And AMREF is the African Medical Research and Education Foundation. And very similar to what you heard from Arlette this morning, is they are using technology-assisted learning centers in Kenya, and they are training up 50,000 nurses. And the reason they're training 50,000 nurses is because they know that's who's providing the care in a lot of their remote settings. But something I also heard Arlette refer to is something we sort of refer to as unintended consequences, is that 8 of the technology-assisted learning centers are in refugee camps. And the health status in those refugee camps, just by putting the telecommunications in there, and training up the local workers, and I use the word nurses very informally. That's why it's very hard to talk about the role of nurses in telehealth, because many times we know that the people that are providing the care are loosely referred to as nurses, but oftentimes they're midwives, traditional birth attendants, community health workers, physician assistants, and all sorts of people in different roles. Okay. So I'm not going to go into all of these, and maybe there are terms you're familiar with. I'll leave the slides behind. If you're not familiar with these terms, it would be very good to look up some of these efforts that are underway. Open Health. There is something called the Open Health Mobile Exchange, pronounced and that is actually a plug-and-play architecture. So sort of like you get with the App Store, with iPads and iPhone. The Open Health Mobile Exchange is very new, but they are working to put a store of apps in there that you can use regardless of your mobile health platform, which is really good. And of course, most people have heard about mHealth Alliance, OpenMRS, and I run for the Collaborating Center, the WHO Collaborating Center. I run something in the upper right-hand corner there called the GANM, which is the Global Alliance for Nursing and Midwifery. It's an electronic community of practice supported by USAID and the WHO. There is one whole component of that electronic community of practice or network that is all in Spanish. So we have a lot of activity actually in Caribbean, South America, Central America, and Mexico. Briefly alluding to this, I think we've heard this before, there is a huge shortage of healthcare workers around the globe. I think we all know this. But there is important economies of scale and benefits that can be brought in by using e-health, just as an ICT, information and communication technologies. Just as Arlette said, we find that there is a real pull out of the rural settings because people feel very isolated. They don't have ways to communicate with other providers and to continue, to continue their education. So very important aspect of using ICT to actually prevent that outflow of people, providers from rural into urban. Another really important point is that from the World Health Report, we know that 50 to 90% of most countries' workforce is made up of non-physician providers. And we have 56 countries with extreme shortages, a lot of them in sub-Saharan Africa, but also there are a few in Latin America as well. Some of the challenges for bringing ICT in, and I see this as my work with trying to bring ICT into community health clinics all over the world, particularly mostly that are run by community health workers, traditional birth attendants, non-physician providers, is an infrastructure challenge. There's no way you're going to get around this. We have problems particularly with electricity because sometimes it's sporadic and non-existent. We have connectivity issues, which can be an issue, but with the BGAN, which are the broadband global area networks that are all satellite-based now, supposedly there is not a place in the world that you can't pick up a signal. How much it's going to cost you is a different question. But that is an issue. And then, of course, access, to the devices, because we put the devices particularly in sub-Saharan Africa, and they are very prone to theft. And they are stolen, not that there's any good reason for stealing, but when you have to make the decision of feeding your family and the opportunity to take a device out of your workplace and cash it in, I can understand as a human why sometimes those things happen. Some of the other challenges is that, we have an issue of the Ministry of Health will say, oh, we have electronic data collection, but do they really? Sometimes, but primarily what's being collected are aggregate statistics, birth and death. And the death records are nightmarish. Very difficult to find out what's going on. I'm in the process of working in a project in Guatemala right now for chronic disease management using mHealth, and being able to get that data to understand how prevalent the issues of hypertension, congestive heart failure, diabetes, very, very difficult. The solution, there's inadequate infrastructure and leadership. The solutions are often not scalable, meaning that people go in with really good intent, they create something small, but once it has outgrown that, there's no way to expand it. Because a lot of people are just trying to figure out how can I solve this one question right now, but not think so much about the future. In the U.S., we have that trouble with our politicians right now. Nobody's thinking to the future. They're all just too busy fighting. Anyway, and it takes a village. And I know that sounds silly, but what I'm saying is that it requires IT expertise beyond the users. So much of the work we've done in Africa, we put in the technology-assisted learning centers, and they break. Something falls, something goes haywire, and where do you get the helper to come in and help you fix that? The local human resources, our lady said, is not there and necessarily available. So it's not only political will, educational training of your clinicians and your health providers, but it's also educational training of the people who are going to support the system. What also we know doesn't work is stovepiping. And stovepiping means vertical systems of care rather than horizontal. I think, we've heard some of that. I'm sorry I wasn't here yesterday to hear, and then, a little bit the day before to hear some of those discussions. But I know that was something that was discussed. And if you look, there's a book by Laurie Garrett. It's called The Betrayal of Trust, The Collapse of Global Public Health. And she is saying that over the past 20 to 30 years, there really hasn't been significant change in mortality, prevalence, and health indicators, no matter how much work we say we're doing. Bill Gates gives millions of dollars, and we build a big viral to create antiretrovirals in Africa, which is good, but they build them in a stovepipe. So what they did was they built this big building, and there weren't any skilled workers to actually work in the building, so where did they get them from? They imported them from overseas. That's not helping the local economy. And also, the other thing I want to say is there's a lack of informatics competency. So we have computer literacy, maybe someone knows how to use a spreadsheet or something, but we don't have informatics competency. And that leads to this problem, which I say here, bright, shiny things don't work. So I'll talk about this later today. I think the message here is that the front line of global health care is composed of many different providers with diverse needs. Access to information is a basic tenet of a developing nation. And efforts to bring ICT in to improve health and decrease poverty are complementary, not competitive. I have my students say to me all the time, Patty, how can you talk about bringing a computer in when they don't even have fresh water to drink? I'm going to tell you that these things work hand in hand, and all you have to do is look at Muhammad Yunus's work in Bangladesh with something called the village phone operators, and what kind of impact that had. As I mentioned earlier, putting the technology-assisted learning centers in the refugee camps in Africa has resulted in not only them training a bunch of nurses, but the health status of that in those refugee camps has just gone right through the roof. Unintended consequences. What's the role of nursing? I think nursing has to step up and lead. And others may have to step down, assist, collaborate, and occasionally just get out of the way. Because it's not about me as a nurse, it's not about Arlette as a physician, it's not about you as a computer scientist, it's about the patient. And it's figuring out how we can all work together to fix this. It's all about team-based, patient-centric, informatics-rich care, and what's the role. So I change it from instead of what's the role of nursing to what's the role of those who care. True introspection, look in your heart. Are you doing the right thing, or are you protecting your share at the cost of care? Leadership, risk-taking, political lobbying, accountability, currency, and flexibility. These are all the roles for all of us, I think. And you're either part of the future or you will be history.